So my name is Elai Buena, and I'm 29 years old. I also do some counseling, and I am currently taking my master's degree in psychology.
Hi everyone, my name is Micaela Larauri, but you may call me Kyla. I'm 23 years old. I'm a model from Cebu City, Philippines, but I'm currently residing here in Metro Manila. And I want to introduce my therapist. This is Blanky.
I'm Hazel Villanueva. I'm a mother of two.
Hi everyone. Good afternoon, everyone. My name is Maria Chan. I'm a very good friend of David. I'm 37 years old. 37 na ako. So, nandito ako sa US.
Ayan. So, good afternoon, everyone. I am Victor Adrian Sari. I'm 23 years old and I'm currently working as a program officer at Philippine Mental Health Association. So, that's a nonprofit organization advocating for mental health and eradicating mental disorders.
Everyone mentioned here that it's not being talked about a lot. There's not much open discussions about it, especially here in the Philippines. How about in your homes in particular? How is mental health um, discussed in your homes, or how did you learn about mental health as you grew up, and to what extent?
It wasn't that much talked about, and I didn't really know much about it. I was more focused before because I'm an only child. I'm an only child, and I tend to be independent at times. When I was in my teenage years, I actually moved out of the house due to some complications when I was 18.
At a very young age, it was not discussed at all. And I feel like it should have been because there were a lot of people in my family that were who are mentally ill. So I felt that that should have been talked about. But it started coming up in our family when I was in my teens, when I started exhibiting symptoms of clinical depression and anxiety. But I feel that if I had known about this at a younger age, I could have been more aware.
Discussion on mental health, especially in the household, has become
Yeah.
a taboo for the longest time, especially here in the Philippines.
Mm,
And there's so much stigma surrounding it that we fail to recognize and even appreciate the essence of taking care of our mental health. And only now, during the time of a global health crisis or pandemic, that we're able to take a kick on why we should really take care of our mental health holistically.
what are common misconceptions when it comes to mental disorders or mental health?
Pag gano'n, laging sinasabi nila na baliw o kaya they're weak, right? They can't handle yung stresses ng everyday life. Pero
Mm.
bakit yung iba kaya? So you just have to cheer up, you just have to think positive and everything else. Parang yun yung lagi nilang sinasabi.
This started when I was around in my teens. I went to a very Catholic high school, and no, grade school and high school. So when I spoke up about my mental health, they told me that all I needed to do was pray. So, but the other misconceptions I've experienced about mental health is just that you're lazy, you're how do you say this? You have no confidence. You just want to sleep all day. People think that symptoms associated with depression are
Yeah.
people simply being lazy. And I hate that misconception because we don't choose to be. We don't want to be. We just want to lead normal lives as well, but then our mental illness hinders us from doing so.
Share some 4 points po on some misconceptions about mental health. First po, I think that people sometimes are unaware that we all have mental health. Parang they are easily captured with the idea that mental health is just for people with mental illness or disorders, where in fact, we all have mental health. Second po, people with mental disorders or illnesses cannot function properly in the society or cannot contribute, where in fact,
Siguro kasi sa Philippines, sorry for the term ha, pero kasi minsan ng mga Pinoy, may pagka-hipokrito. Yung tipong alam naman nila na merong posibleng ganyang problema, pero they try to dismiss people. Kasi kunwari, may pinag-usapan lang na na-depress or something, yung iba sasabihin,
Mm.
ay, ang arte mo, ang dami mong hanash, yung mga ganun lang. So, yun yung nakakasad sa Philippines kasi hindi ganun ka-open na there is an issue. Malaking issue yan. Hindi lang nila ina-address.
Here in the Philippines, pag yung family mo nalaman na merong bipolar disorder or anything na related sa mental health state, parang kinakahiya nila.
What do you feel about medical professionals? Are there dangers in self-diagnosis?
It is expensive. Here in the Philippines, it will probably cost you like minimum of 1,500 to visit a professional.
And when someone self-diagnoses their own psychological feelings, they may miss a medical disease. Just to put it out there, a medical disease or condition that contributes to your symptoms, like what Ms. Pat said. It may have something to do with the hormonal imbalance, chemical imbalance. There are instances when you yourself miss something that you cannot see, right? So I agree that seeking professional help, I know it's really expensive, but I think when we invest it in the right um in the right expenses, the results are long term naman. Hindi naman siya band-aid solution lang.
I wanted to ask as well if anyone here is undergoing therapy or medication.
So I was diagnosed with panic disorder. Because of that, my heart gets worn out.
I was diagnosed with clinical depression at age 14, but then little did I notice a misdiagnosis. In the beginning of my bipolar journey, I was 19 when I got diagnosed. I was on a bunch of medications. And just a little side note, I'm super connected with Metro Psych. They are the best. I love them so much. My psychiatrist is from Metro Psych, and I have been seeing her for 6 years, and it's been amazing. And wow, you should check them out. Little plug right there. So yes, that's all I have to say regarding that. Thank you.
Yay! Thank you. So anyone else would like to share their experiences maybe, or if their acquaintances experiences on this, or your thoughts on therapy and medication, or questions actually, since we have
Maybe learn to trust and love yourself first.
yes
So you can reach out to people, so you can be open to other people.
yeah okay.
And for your past experiences, forgive people so you won't hold any grudges.
One, two, three. Okay, done. Stay safe as well, Pat.
Thank
you
you.
guys.
Bye.
Bye.
Stay safe.
Meeting you all
Thank
in
you.
Okay,
Bye.
bye.